Hello everyone, welcome to our channel Mind, Myth, Momentous, that is M3. If you are new to this channel, please subscribe and hit the bell icon to get the regular notifications of all our new uploads. In today's episode of the series Stress, Anxiety and Depression, we will try to understand the topic stress and its types. For an individual who is in stress and tension, stress can be defined as someone who is trying to repair the entire situation single-handedly. Hence, lending a listening ear and helping hand by anyone timely can save further complications in an easier way. What is stress? In a medical or biological context, stress is a physical, mental, or emotional factor that causes bodily or mental tension. Stress is a response to a threat in a situation. Stresses can be external, from the environment, psychological or social situations, or internal, like illness or from a medical procedure. Stress can initiate the fight or flight response, a complex reaction of neurologic and endocrinologic systems. There is good stress and bad stress. Good stress can keep you focused and motivated to get things done. For example, being stressed about giving a presentation can motivate you to prepare and rehearse. Whereas bad stress is what you feel when you can't stop worrying about something and you feel overwhelmed all the time. This can cause stress overload. Good stress can be called as acute stress, which can stay from minutes to hours. Whereas bad stress can be called as chronic stress, which can last from days to years. In psychosocial aspects, good stress has high accountability and autonomy, and bad stress has low status and lack of control. If we see the immune system effects, good stress has increased mobilization to sites likely to be wounded, while bad stress has immunosuppression, autoimmune or inflammatory disorder. The cardiovascular effects on people with good stress are increased efficiency to sustain physical exertion, whereas for people with bad stress, it develops hypertension, heart attack and stroke. Brain effects of good stress are increased synapses turnover and neuroplasticity, whereas of bad stress, it decreases hippocampal volume and prefrontal function. In general, there are three types of stress: acute stress, episodic stress and chronic stress. Number 1. Acute stress. Acute stress is one of the least damaging type of stress, which is considered good because it is also the most common type. We experience acute stress multiple times throughout the day. Acute stress is experienced as an immediate perceived threat, either physical, emotional or psychological. Stress hormones in a patient can rise for several days after the trauma. Anything less than 3 days may simply be a normal stress response to that trauma. When acute stress continues for longer than a month, the patient may have an anxiety disorder. Let's see the symptoms of an acute stress reaction. Symptoms usually develop quickly over minutes or hours, reacting to the stressful event. They usually settle fairly quickly but can sometimes last for several days or weeks. Symptoms of acute stress reactions may include the following: psychological symptoms such as anxiety, low mood, irritability, emotional ups and downs, poor sleep, poor concentration, wanting to be alone, etc. Recurrent dreams or flashbacks which can be intrusive and unpleasant. Feeling emotionally numb and detached from others. Recklessness or aggressive behavior that may be self-destructive. Avoidance of anything that will trigger memories. This may mean avoiding people, conversation or other situations as they cause distress and anxiety. Physical symptoms such as thumping heart, a feeling of sickness that is nausea, chest pain, headaches. The physical symptoms are caused by stress hormones such as adrenaline, epinephrine, which are released into the bloodstream and by overreactivity of nervous impulses to various parts of the body. If we have to mention it in general, the person feels emotional problems, muscular problems. Physically, the person may have elevated blood pressure, rapid heartbeat, sweaty palms, heart palpitations, cold hands or feet, dizziness, chest pains, or also an individual may have stomach problems like heartburn, acidic stomach, flatulence, diarrhea or constipation, or IBS, that is irritable bowel syndrome, etc. Treatments for acute stress disorder. Generally, no treatment may be needed as symptoms usually go once the stressful event is over and you deal with it. Understanding the cause of symptoms and talking things over with a friend or family member may help. However, some people have more severe or prolonged symptoms. Some of the treatments which may help can be one or more of the following. It can be cognitive behavior therapy, counseling, and or medications. We will understand CBT in one of our another episode. Number 2, episodic stress. It can also be called as episodic acute stress disorder. The triggers in episodic acute stress disorder may seem almost mundane to others, leading them to mislabel or misunderstand the person suffering from that disorder. The patient with episodic acute stress disorder experiences real and intense stress that feels very dangerous to them. For example, an individual whose boss is unhappy with him or her. The person with episodic acute stress disorder may extrapolate from that incident that they will soon be jobless, impoverished, and homeless. This may be reasonable and real to that individual, but it interferes greatly with their ability to conduct a normal life. People with episodic acute stress disorder often do not seek help. This is because they may think either their reactions are normal or others may dismiss or belittle their reactions. It becomes very important, therefore, to learn to identify the signs of this disorder, which includes irritability, anger they cannot control, increased heart rate, panic attacks, heat, burn and stomach troubles, muscular pain and tightness. When patients do not seek help, they can get physical symptoms as well, including high blood pressure, heart disease, frequent headaches, etc. In general, the person with episodic stress disorder may suffer from cognitive symptoms, develops emotional problems, may have physical symptoms, or behaviorally the person may start eating more or less, has irregular sleep patterns, isolating behavior, procrastinating or neglecting responsibilities, using alcohol, cigarettes or drugs to relax, developing nervous habits like biting nails, pacing, etc. Treating this mental health disorder can involve medication, lifestyle changes, and different types of therapies. The patient and therapist will work to uncover what works best. In some cases, a person may need to make a significant change, such as leaving or change of a job. Therapy often involves CBT so that patients can identify triggers and learn coping skills. When stress levels are too high or triggered by a process, medications can be helpful. Number 3, chronic stress. Chronic stress leads to serious health problems because it disrupts nearly every system in your body. Now, what is chronic stress? A patient with chronic stress almost constantly experiences elevated cortisol and adrenaline levels. These feelings cause the patient to always feel on high alert, having difficulty relaxing, and even develop anxiety disorders. Chronic stress is typically a response to one or more long-term triggers. For example, if an individual who is having his loved ones chronically ill since long may feel stress more often. Over time, this becomes chronic stress that can have several physical and mental effects. Signs of chronic stress. Someone with chronic stress disorder may exhibit several troubling symptoms. The build-up of stress over time may cause an individual to act out or behave differently than he/she used to be. Its effect on individual depends from individual to individual. Some common symptoms include extreme or unusual irritability, difficulty concentrating on daily tasks, frequent headaches, low self-esteem, changes in appetite and digestions, helplessness, sleeping problems, feeling out of control, etc. CBT and lifestyle changes often help people with chronic stress disorder to manage their symptoms. In therapy, patients identify their significant stressors. The therapist then works with the patient to learn how to cope up with those problems. In some cases, lifestyle changes are enough on their own. However, most patients also need CBT to learn coping mechanisms that they can carry into every aspect of their lives. Working on lowering stress levels can include learning about the 4 A's: avoid, alter, adapt, accept, mindfulness like breathing exercises, meditations, and building a social support system. Stress recovery can also involve exploring the emotional causes that are contributing to high levels of stress in the first place. The best way to beat stress-related problem is to come in earlier rather than later. That way, recovery time isn't as extensive or difficult. The more you can become aware of your specific symptoms, the easier it will be to create healthy stress-reducing habits for the future. Thanks for watching. Please like, comment, share, subscribe our channel Mind Myth Momentous, that is M3. Please don't forget to press the bell icon for notification of all the new uploads. In the next episode, we will try to understand response and effects of stress on our body. Till then, bye.